Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. The inability to sleep is an epidemic here in the United States, and sleep is necessary for proper healing and recovery. So let's get into the 3 common reasons why you cannot stay asleep once you fall asleep. So let's get into the facts. 3 common reasons. Number 1 is hypoglycemia. Hypoglycemia is a drop in blood sugar. So this can often happen with people who have anxiety, who have maybe low blood pressure, who had concussions, where they basically burn up their fuel. Hypoglycemic symptoms are when you eat and maybe 1 or 2 hours later, you have a drop in blood sugar and you can have irritability, you feel shaky, you can feel angry or hangry. So you have these signs and symptoms. People don't realize though, when you have blood sugar drops in the middle of the night, it can wake you up from a deep sleep. So let's say you have dinner around 6 or 7, okay? And you don't want to eat anything else because you don't want to gain weight, etc. So in around 1, 2, or 3 in the morning, what happens is your blood sugar will start to drop and cortisol will start to go up in order to signal the liver to produce more sugar. When cortisol goes up, it wakes you out of a deep sleep. And then you'll wake up 2 in the morning and cannot fall back asleep, maybe an hour or 2 before you can go back to sleep. So hypoglycemia is one of those reasons that people don't think about when it relates to sleep disturbance. Number 2, silent reflux. People who have reflux disease or GERD or gastroesophageal refluxive disease, you can have a little bit of stomach acid that regurgitates slightly up and it causes a cough. So when you lie down in the middle of the night, you can start to cough in the middle of the night, waking you up out of a deep sleep. So if you have a cough that gets worse in the middle of the night or when you first lie down, then you want to look at reflux disease. When you're looking at reflux disease, you're looking at either low stomach acid issues, high stomach acid issues, H. pylori infections, or food sensitivities. So you have to look at multiple factors when we look at silent reflux. Number 3 is diabetes and prediabetes. So diabetes will create things like restless leg syndrome. It can also create things like peripheral neuropathy, where you have burning, numbness, or tingling in the feet. And diabetics also tend to get up frequently in the middle of the night to go to the bathroom. So they get up, go to the bathroom, maybe not fall back asleep again. So these are very common symptoms related to sleep disturbance in the middle of the night. Obviously, there are others. Pain is one. So if you have lower back pain, you have sciatica. Pain can be one of those contributing factors where it wakes you up in the middle of the night and you can't go back to sleep because pain also stimulates cortisol. Perimenopause and menopause. Obviously, there are things like night sweats and hot flashes that will wake you up in the middle of the night and you can't go back to sleep. Sleep apnea or obstructive sleep apnea. People who do not sleep through the night because of breathing issues, snoring. So this is one where your partner or spouse can listen to you in the middle of the night and they see that you stop breathing for 10 seconds or you snore very heavily. Those people with sleep apnea will have significant fatigue in the afternoons, in the mornings, they just can't get enough oxygen throughout the night and not the proper deep REM sleep. So sleep apnea is a big one. Post-concussion. Most people think about you have a concussion and they might sleep a lot, okay? But there is a flip side to this where people have concussions and they cannot sleep or they wake up and they can't go back to sleep. And the reason this happens is because it's neuroinflammatory. There's some activation of immune cells called microglia in the brain, and it creates this vicious cycle where you just can't regulate cortisol and melatonin, okay? The other one is benign prostatic hypertrophy. If your prostate's enlarged, you will get up and go to the bathroom multiple times throughout the night. So urinary frequency is another factor. So when we look at these facts, these three are very, very common. So is pain, menopause, perimenopause, sleep apnea, post-concussion, and benign prostatic hypertrophy. In terms of hypoglycemia, the way to correct this is eating good quality protein and fats into your diet and reducing complex simple carbs or sugar. Also, eating maybe like a sliver of turkey with avocado will stabilize your blood sugar. Turkey is high in tryptophan, so you will also get into a deeper sleep. You want to eat the turkey and avocado maybe 1 hour, maybe even half hour before you actually go to bed. That way your blood sugar will not drop and you have excess levels of tryptophan so you can sleep deeper. Silent reflux is more complicated because you have to look at food sensitivities, maybe take digestive enzymes, maybe gallbladder issues. So there's multiple factors with silent reflux and you need to get to the root cause of it. Diabetes, pre-diabetes, you need to get your blood sugar checked. You want to do a fasting glucose. You want to do a hemoglobin A1C on blood work. You could even do something called fasting insulin or C-peptide to look at if you have diabetes. So it's very important to get to the underlying mechanisms to correct the sleep. Sleep is crucial for you to recover and heal from chronic disease. If you have autoimmune disease, you really need to sleep in order to recover. So sleep is crucial to your health and recovery, as well as food, lifestyle, reducing stress, etc. Okay, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.